Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solome Tibu, your host of the Expanding Access podcast, and I am thrilled to have another special guest with us this week, really an incredible addiction expert and clinical leader, business leader, Dr. Coffey. Really appreciate the opportunity to have you on the podcast. To get started, can you tell our audience just a little bit about yourself and how did you get into this industry?
Well, thanks again for the invitation, Solome. I'm just delighted to be with you and so grateful for all the convening and energizing that you do to help people who want to make a difference in the behavioral health world. And I'm certainly one of them. So count me as one of your many fans. And thanks again for the chance to spend some time with you today. Yeah, I can share a little bit about my background. I'm by training a neuropsychiatrist, by, I think, vocation, a student of systems thinking and care design. And probably by nature, I'm someone who performs best in thoughtful conversation with others. And really by nature, I'm a family man. So it's a little bit about me, both inside of work and outside of work. I have had the pleasure of leading a team of incredibly smart, dedicated, passionate individuals at WorkIt Health for the last several years, trying to move the needle in the substance use disorder care space. And prior to that, I really spent a number of years in academic medicine, typically in large integrated health systems, and also in some smaller private nonprofit psychiatric hospitals, having lots of different neat opportunities to try to build systems, redesign care, putting patients and their loved ones in the center of all that care and seeing how we could make that work. And those experiences somehow led to a really neat opportunity to serve as the physician leader at WorkIt Health, where I am today.
Amazing. You've had just such an incredible career and grateful to have your expertise here. And one thing that I know that you've talked about quite a bit before is this idea of patients as designers. Can you talk a little bit about what that means in practice and how it's shaped the care experience, particularly at what you're seeing at WorkIt?
Absolutely. I love this phrase. I love this concept. But let me make one thing very clear at the outset. Patients as designers is not my idea. It is WorkIt's mantra. It's a mantra that was conceived first by two formidable women who co-founded at WorkIt Health, I guess over 10 years ago now, Lisa McLaughlin and Robin McIntosh. And it's the idea, patients as designers, is the idea that actually made me first fall in love with WorkIt and made me somehow feel willing to take a leap and take on a new role for a kind of organization I had never really worked with and worked for prior to that point. But the idea, Solome, is a simple one and a profound one, which is that people who receive care, that's all of us, right? We all have some experience of care over the course of our lives. We all have expertise in that experience. And what might healthcare delivery look like if we simply asked people with lived experience to be the ones who were the primary designers of how care would or could be delivered? So it's the idea of bringing patients, their loved ones, their significant others, to the actual design table and empowering them and trusting them to tell us the answers. And by us, I'm referring to people like me, healthcare professionals who for a long time have harbored the delusion that we know best. And while I think there's a lot that we could talk about this afternoon about the importance of science, scientific inquiry, scientific study to help us develop treatments and arrive at the evidence in support of prescribing, recommending certain treatments. What I'm really talking about is how those treatments are provided. What's the experience of care? And so one of the things that is so powerful about WorkIt is that this mantra is not lip service. It's much, much more than that. And so from the very beginning and at every level of the organization, we have individuals with lived experience with substance use disorder at various stages of their own personal recovery who are the ones who are making the design decisions. And to me, that's very humbling as a physician. And it's just exhilarating as someone whose personal and professional mission is to try to make healthcare quality better for everybody in this country. So patients as designers, no, I do not have a tattoo, but I feel like I probably could. And so maybe we can talk about that another time.
That is wonderful. And sticking to this theme of values and practices that WorkIt embodies, I understand that your team really emphasizes a lot around whole person care and a whole person approach when it comes to addiction care. From a clinical and scientific perspective, what does whole person care look like, especially in a digital environment?
Yeah, it's a great question. It comes out of the patients as designers mantra. Again, if I could take a step back, one of the first things that you may not be surprised to hear, but that you hear when you ask people in recovery, how would you design care? One of the first things that they say is access. They often don't use that word, but they say, look, I have an illness or a condition that sometimes leaves me with these fleeting moments, these very brief windows in which I'm motivated to engage in recovery and treatment. And the delivery system has to be there when I'm ready. And so one of the first tenets, one of the first, if you will, pieces of build at WorkIt a decade ago was, how do we build for immediate access? And I heard about this when I was leading a very large behavioral health service line at a very large integrated health system in the Northeast. And we were having pizza parties when we would get our wait list down from 100 days to 80 days. And at WorkIt, we don't even track wait lists like that. We designed the delivery system to be able to rise up and meet the member where they're at when they're in that moment of wanting to engage. And it's really quite amazing when we talk with brand new members who are offered an appointment that very same day that they sign up, and they say, wait, how about tomorrow? I'm not quite ready to do it today, but they're just so disoriented by the availability. And we made that an aspect of design affordable. That's the other thing. Whole person care, to answer your question, is another outgrowth of this patients as designers philosophy. So the idea is, hey, I might have an alcohol use problem, or I might have an opioid use problem, but there tend to be also these common problems that run along with my main problem. So for example, at WorkIt, if we look at our population of folks who struggle with opioids, 75% of those folks screen positive for either anxiety or depression. So comorbidity with anxiety or depression is the rule rather than the exception for the folks that we serve. And the healthcare community might say, oh, well, you're doing integrated care, or you're doing collaborative care, or you're doing medical home for people with substance use disorder. We just call it patients as designers. But the idea is, if you want your anxiety and depression care also to come from WorkIt because you think of it and you experience it as part of your substance use problem, we're happy to do that. And if you don't want that care from WorkIt, we're not going to force you to do it. We're not going to say it's getting your depression care from us is a requirement of being in our program. Now, whole person care also means we know our customers and we design for the people that we serve. So you might be someone with opioid disorder who also has leukemia. WorkIt will be the first to tell you, we're not your best leukemia provider. In fact, we're not going to be your leukemia provider, and we're not going to do your rotator cuff repair. All right. But if you struggle with tobacco and smoking, we're going to help you. Insomnia is another big one. Hepatitis C is another thing that we commonly help people with. Screening and treatment for sexually transmitted infections is a common request that we get. And the whole idea is, all right, if this is the kind of care and the other aspects of care that the folks that we empower to design our delivery system want us to build around and build for, then we try to do that. So that's what whole person care means at WorkIt. But it all comes from this sort of bedrock of patients as designers.
Wow, what a huge difference in time, delivery quality. Thank you for sharing that. I'd love to bring up a topic that I hear quite a bit, which has been that digital care has been often criticized as being impersonal. Can you talk about what WorkIt has done to ensure that virtual care actually increases connection, safety, and engagement?
Oh, I'd love to. We're started a decade ago when two amazing women were trying to figure out how to get more access to buprenorphine for the friends in their recovery community that they were seeing continuing to die. Okay. And there was plenty of brick and mortar availability for some of these folks. And in some places there wasn't. But the whole idea was, hey, can technology be brought to bear to remove some of the barriers to receiving this first-line evidence-based gold standard treatment? So the idea that technology could enable the delivery of some of these services is part of our DNA. And that doesn't mean that a tech-enabled virtual first approach is what every single person out there necessarily wants or needs, but it is absolutely feasible for the people that we serve, and it's preferred by the people that we serve. We have a brick and mortar presence in every market that we operate in. So I don't even know if you know that. And almost none of our members choose to be seen in person. These are folks whose experience of care prior to this point has been characterized by barriers, stigma, shame, and now they can have their appointments, they can have support groups, they can do drug screens in the comfort of their own home or the comfort of their office, workplace environment, in their cars, you name it. And the idea of using technology to help empower our members to have the kind of experience receiving care that we would want our loved ones to have, one that's judgment-free, that's shame-free, and that's easy and accessible. I'll give you maybe some takeaways here. So we're able to reach rural populations of individuals with alcohol use disorder, individuals with opioid use disorder, areas that have been particularly hit hard by the opioid epidemic. And these folks tell us if it weren't for WorkIt, they would have no care. We also have amazing outcomes among individuals with opioid disorder who are pregnant. And what's amazing is they might have a brick and mortar operation somewhere in their town. Pregnancy is an exclusion criteria for many of those programs. And we expressly wanted to design against that. We wanted to be able to serve individuals who were pregnant or trying to become pregnant. Technology has made all that possible. How do we eliminate shame and stigma? We develop proprietary technology that allows us to do urine drug screening using your smartphone. No one's got to watch you pee in a cup. Talk about revolutionizing the way that care is delivered. It's all about patients as designers. And again, it's what I really think is a very powerful concept for all of U.S. healthcare to give some serious thought to.
Yeah, such remarkable examples. You've already touched on a couple obstacles that patients face when it comes to accessing care. When you think about designing treatment pathways, can you talk a little bit more about some of these obstacles and particularly around how design thinking has helped reduce those in your experience?
Yeah, absolutely. I think the first thing that comes to my mind is the recognition that as healthcare providers, now more than ever, we play a team sport rather than an individual sport. And so part of the core competency of healthcare providers, in my opinion today, has to be teamwork. And so we spend a lot of time on developing high-performing teams. And one of those competencies is improvement science itself. How do we rapidly test out ideas and learn from those tests of change? We want those tests of change to be deliberate, meaningful, measurable, and we want them to be efficient, right? We want them to not take 12 years to get through the sort of experimentation phase. And so we've got a team sport, we've got continual quality improvement, and we've now got technology that can enable so much of that. And you put those ingredients together, and now you've got something special. I think if you can bring patients and their significant others into the mix, you'll be able to accomplish more than you probably ever were when you were thinking about healthcare delivery in kind of an older way or a different kind of model. So that's how we begin to think about it at WorkIt. And what does that look like? So for example, we had a large portion of our members who were struggling with opioid use disorder, who we thought would benefit from more psychosocial support. And for a number of reasons, probably many related to the barriers of shame and isolation, were uncomfortable sharing themselves and their stories with others. And so in an attempt to try to design for that, again, bringing those folks to the table, we created an opportunity for folks to have group-based visits, but across state lines. And so if you're in New York and I'm in Pennsylvania, we might be in a group together, but there's no risk that you and I live in the same neighborhood are going to see one another on this computer screen. And maybe that's something that works for some people. We also have created these group-based visits so that folks can receive smaller doses of psychosocial support, mutual support, motivation enhancement, because that dosing approach, that right-sized, small bite kind of approach works best for them rather than requiring them to participate in 50-minute counseling sessions once a week. Again, nothing wrong with that approach, but we want to be able to design the delivery of care in a way that is really, truly centered around the person. And dosing approaches to mutual support have turned out to be quite effective for an important segment of our customers and members that have problems with opioids. So those are a few examples, and happy to go into more detail if you'd like, but hopefully that illustrates what we're talking about here.
That's great. It's just more examples of really meeting patients where they are. Yes, listeners have a lot to learn from this. Now, Dr. Coffey, if we could pivot to a little bit about the future, where do you see the next leap forward when it comes to patient-centered digital care, and what innovations are you most excited about?
Everyone's talking about AI, of course, these days. And when I think of AI, I think of what's already in place today, which is a fair amount of AI or AI-informed technology that's enabling administrative efficiencies. Now, we've got plenty of that taking place at WorkIt. We have scheduling systems for members' appointments, for example, that are light years ahead of any kind of scheduling system I've ever tried to help develop or practice within over the years. But there's an important question for our field and really for our society here, which is what role should AI play in the actual delivery of care? Should or could there be a safe and appropriate role for AI as a member of the care team? And I'm not sure where our society is going to land on this. I'm glad that there's a more and more elevated conversation about it right now in some circles. But I do think that it's going to be really important for folks making those policy decisions to understand that patients, members, their loved ones are already using AI tools out there to learn about their care, to advocate for themselves, to understand their care. And I think we would be wise to, and again, dare I say, patients as designers way, understand that AI is already in the doctor's office. It's already in the examination room. And so let's be thoughtful and deliberate and transparent and collaborative about how we try to determine what we want AI to be. And let's engage in it. Let's not be passive in that conversation. So I'm excited to see what happens in that space, of course, and hopefully folks that are struggling with addiction can benefit from it.
I couldn't have said it better. Yeah, AI is here, and it's best not to be passive. And so thank you for that. Now, if I could just ask you one more question, Dr. Coffey, just statistically, we will have listeners who are struggling or maybe some caregivers who don't know where to turn. If you could just end on this note, what advice might you have for listeners that are contemplating taking the first step to getting care, and what should they look out for when seeking care?
Thank you for asking that question. I would invite individuals to advocate for themselves, to trust themselves, and state out loud what is the care that you think that you need. Be an advocate for yourself. And don't continue to receive treatment from someone that has a problem with your self-advocacy. Really look for healthcare providers and people to be on your care team who really believe that you're an expert in yourself, that want to include you as the quarterback of the team, even on your worst days as much as on your best days. Know that there are healthcare providers and provider organizations out there that want to design the care that you may want and need at some point in time. And so you keep trying to find that good fit, and you can certainly contact WorkIt Health.
Awesome. Thank you so much for that. Dr. Coffey, I always enjoy every conversation we have. Thank you for taking the time to share your expertise with the behavioral health tech audience.
Appreciate you so much, Salome. It's been my pleasure.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.